Many families hear just two things after a diagnosis: wait and see or prepare for surgery. But what if there's a third option? One that's backed by research, tailored to your spine, and already helping thousands of people just like you. I'm Mirenzi, a physical therapist and head of research and communications at ScoliCare, where we help children and adults get specific, non-surgical treatment for scoliosis around the world. In this video, you'll learn exactly how scoliosis progresses and what actually works to manage it without surgery. Here's the problem we see almost every day at ScoliCare. Most people are given incomplete or outdated options. A child gets diagnosed with a 25-degree curve and the recommendation is, let's just monitor it. An adult has back pain and posture issues, but is told nothing can be done. Or worse, the first treatment option mentioned is surgery. But scoliosis isn't a one-size-fits-all condition. Waiting without action can allow curves to progress, and surgery, while necessary in some cases, isn't always the right step. That gap between diagnosis and meaningful care, that's where patients get lost. And it's exactly the gap we've spent years working to close. Let's talk about a real patient, Mia. She was 13 when her parents noticed her right shoulder was higher than the left. Nothing dramatic, just a subtle shift. Her doctor ordered an X-ray. The diagnosis, idiopathic scoliosis, 33.9-degree curve. That's when they found the team at ScoliCare. At her first ScoliCare appointment, we conducted a full 3D assessment, not just of her spine, but of her posture, balance, and growth stage. Within days, Mia was fitted with a custom ScoliBrace designed to gently overcorrect her curve in brace to create the best possible out-of-brace correction long-term. She began our ScoliBalance exercise rehabilitation program with a certified provider, focusing on active self-correction of her curve in a 3D manner, building core strength, symmetry, and alignment. Within months, Mia's curve had stabilized and over time even reduced. No surgery, no long-term recovery, no regrets. Stories like Mia's aren't rare. They're what happens when families get access to the right tools at the right time. So what made the difference in Mia's case? It wasn't a miracle, it wasn't a wait-and-see approach, and it definitely wasn't surgery. It was a personalized, non-surgical treatment plan built just for her. But here's the truth. There is no single fix for scoliosis. Every curve is different. Every spine is different. Every patient has a different goal. Whether that's avoiding surgery, reducing pain, or improving posture and confidence, the real key is understanding which treatments work, when they work best, and who they're right for. So how do you do this? What does actually work when it comes to treating scoliosis without surgery? A personalized plan that's designed around the person, not just the curve. We don't treat scoliosis with a generalized approach. We match the treatment to the type of curve, the severity, the stage of life, and what the patient actually wants out of care. And how do you do that? We use 3 core tools that consistently deliver results. Number 1, 3D custom bracing, the ScoliBrace. This isn't just an old school plastic brace that tries to hold the spine in place. ScoliBrace uses 3D scanning to custom design a brace that actually works to correct the spine's alignment while the body is still growing, or in some adult cases to support and stabilize posture. It's shaped to gently guide the spine into a better position, not just stop it from worsening. And because it's custom made for each patient, it's more comfortable, more discreet, which most people prefer, and often much more effective. Number 2, a ScoliBalance exercise program. These aren't just general stretches or random core workouts. They're scoliosis-specific movements taught by a trained provider that are designed to rebalance the spine and the muscles that support it. Think of it as re-educating the body to move in a more balanced, upright, and aligned way. For growing kids, it supports long-term spinal development. For adults, it can reduce pain, improve posture, and prevent further collapse, especially with postural or degenerative scoliosis. And number 3, an early proactive intervention. The earlier we start, especially during growth spurts, the better the outcomes. But even in adults, timely care can relieve symptoms, improve function, and avoid unnecessary surgery. Non-surgical success comes from combining these tools strategically, not guessing, not waiting, and not rushing to surgery. Here's the big idea. No single method is a magic bullet. But when we combine the right brace, the right exercise, and the right timing, that's where real transformation happens. And it's not just theory, it's what we see in our clinics with real patients every single day. So, if you or someone you care about is dealing with scoliosis, you might be wondering, okay, this all sounds promising, but where do I even begin? However, before we dive into treatment options, let's talk about something most people never get a clear answer on. What actually causes scoliosis? The most common type is idiopathic scoliosis, which means no known cause. It usually shows up during growth spurts and most often in preteens and teens, and it tends to run in families. But that doesn't mean it's random or hopeless. We can track how it progresses and how the body compensates and how to guide it safely with the right treatment. There are also other types of scoliosis. Congenital scoliosis, caused by spinal abnormalities present at birth. Neuromuscular scoliosis, linked to conditions like cerebral palsy or muscular dystrophy. And degenerative scoliosis, which develops in adults over time due to disc or joint breakdown. Understanding the type of scoliosis is key because it shapes the treatment plan. So, how do you take action today without feeling overwhelmed? Step 1, get a proper scoliosis assessment, not just an X-ray. You need a full clinical evaluation that looks at the spine and the body, posture, alignment, flexibility, muscle patterns, and if needed, a 3D scan. This helps us understand exactly what kind of scoliosis we're dealing with and how it's affecting your life. Step 2, understand your treatment options. Based on your curve type and severity, we explain what's realistic and what's recommended. That might include custom bracing, scoliosis-specific exercise, posture rehab, or a combination. You can learn what each tool does, when to use it, and why it matters by watching this video. Step 3, choose a plan tailored to you. We don't do generic care. Your treatment is designed around your spine, your goals, and your lifestyle. Whether that's a teenager navigating school and sport or an adult wanting to stay active and pain-free. And lastly, step 4, stay consistent. Stay supported. Results don't happen overnight. With the right tools and regular follow-up, they do happen. You'll have guidance from trained providers who specialize in scoliosis and who track your progress over time, not just hand you a brace and send you home. Remember, the most powerful step is the first one, getting informed and evaluated by a team who understands your condition and actually knows how to treat it. By now, you've seen that scoliosis doesn't have to be life-altering or an automatic path to surgery. There are proven non-surgical options that are already helping people around the world. From kids like Mia to adults managing pain and posture to clinicians seeking better tools for their patients. The most important thing, knowing that you're not alone and that real help exists. So, what does this all mean for you? Scoliosis is complex, but the treatment doesn't have to be confusing or extreme. At ScoliCare, we've helped thousands of people manage their scoliosis using the same approach you've seen in this video. Personalized assessment, 3D custom bracing, scoliosis-specific exercises, and specialized support every step of the way. No scare tactics, no one-size-fits-all plans. Just clear, research-backed care built around you or your child. You don't have to wait, you don't have to guess. There's a proven non-surgical path forward, and we're here to help. Thanks for watching, and we'll see you in the next video.